think Tommy gave us a really good insight into the partnership model, which is not really always understood and clear, and the benefits of it. But particularly, Tommy, thanks to your work on relation to the crack cocaine issue in the community. I know there was some really good successes and innovation from it, so well done overall. Okay, our final speaker now is Joe Kirby. We heard a lot earlier on this morning and previously about integrated services, and Joe is going to give you a perspective in the Cork and Kerry region of an approach they take around integrated services. Joe.
Thanks, Chair. Joe Kirby, as our chairperson said, so I work with HSE Social Inclusion Cork Kerry, and I'm the speaker, the last speaker before your lunch, so I'm guessing everyone is thinking this fella better not be a talker from Cork. I know our chair is definitely thinking that, so I'll get on with it and I'll try and be as quick as I can. What I'm going to talk to you about is a new service model delivery in Cork and Kerry. It's a significant piece of work. It's 4 years of work. I have to say it's a live project. We're still refining it. It's a significant partnership between the HSE and the community voluntary sector, and our key partner in the community voluntary sector being Coolmine. But very importantly also, it includes 2 drug and alcohol task forces. As I said, the timeline is 2018 to now. So, any self-respecting Cork man presenting in Dublin has to put up the map of Cork and Kerry in case people forget about where we are. We're a very quiet gang down there. We never shout or make noise or tell everyone we're brilliant at everything. So just in terms of our responsibility from a HSE perspective, when we sit down to plan services, that's our reality. That's what we're responsible for. Cork and Kerry, a huge population, huge geographical area, and that's challenging for the HSE to get services everywhere. Urban-rural divide, and also in the context today, we're talking about community drug and alcohol task force projects. But ultimately what we're trying to do in Cork and Kerry is actually integrate them into the broader HSE infrastructure, into primary care, work with our hospitals, work with mental health, and really have it front and centre in terms of an integrated care approach with Coolmine, our key partner. Very briefly, our previous model, what did it look like? A patchwork quilt. I think that's the 3rd time today patchwork quilt has been mentioned. That's the reality of what we had. We had some phenomenal staff, some phenomenal agencies working, but we were a patchwork quilt of services. We didn't have a consistent design across the Cork and Kerry region. 12 different employers, 31 different services, people working as lone workers, really good staff, but in terms of a service user or family member presenting for services, it was complicated. It was overly complex and it was a little bit fragmented. So in essence, we were creating inequalities across the region because you couldn't get under 18 in one part of the city, you could in another. Other services worked with families, others didn't. So depending on where you lived, you got a certain type of service. So we felt we needed to address it. We did what we always do in Cork and Kerry. We look at reviewing and evaluating what we have. So we contracted with an independent consultant, Frank Murta from Belfast. He came down, he looked under the bonnet effectively of drug and alcohol services, and he began to benchmark what we were delivering against the key metrics in our sector, the Health Research Board data, our National Drug and Alcohol Strategy, Schlein to Care, were we delivering our services in line of all those key strategies, and really importantly, looking at the Pobble Deprivation Index. Were our services being delivered in the areas of high deprivation by virtue of that index? Were we maximising what we had? And were we delivering to communities? Because ultimately that's what we're about. A lot of recommendations, too many for today. They're the 3 kind of core ones I'm going to talk to you about today. Co-locate the workers, develop regional hubs with clinics, so a hub and spoke model. Most importantly and most challenging, go from 12 different employers to 1. That's a considerable piece of work. Anyone involved in any change management process where there's employment, terms and conditions, 2P legislation, staff, fear of change, all that goes with that, that's a significant piece of work. It took us 2 years to do that, right at the start of COVID, so we were doing both in parallel, responding to COVID-19 and probably going under our biggest restructuring we've ever done. Challenging 2 years. I'm going to fast forward those 2 years. The end result was Coolmine Cork Kerry. And that's what came out of that review. 1 agency, Coolmine, delivering our community drug and alcohol services. The structure currently now is we've 6 distinct hubs working across Cork and Kerry, based on, as you see, per region. Each hub is a team leader, a project and a team of project workers. But most importantly for me, from a service user's point of view and a family member's point of view, the phone numbers here to distill that amount of funding and management and layers and treatment modalities into one number where you can access it. Anyone can ring that number and access the service. So as a family member concerned about their loved one or someone in crisis, where do I get help? How do I do it? We, the HSC and others, we can be difficult to navigate and difficult to access services. So now, if I live in East Cork, or I should say if I was a professional GP, social worker looking to make a referral, if I live in East Cork, West Cork, that's the number. You get into the service, you talk to the team leader, and you're in the system. It's up to us then in the HSC and Coolmine to build that integrated system behind them. Once they get in, they'll need other pathways, so that's our responsibility to make sure that they're integrated as they go through the system. So that's a really important point for me. We're talking about integrated care, but we're also talking about easily accessible service for people who are in crisis a lot of the time. So, very briefly, I'm just going to highlight the top figure there. This is some of the stats from our new structure. The number one referral source is self-referral. That's telling us people are actually picking up the phone and being confident in referring themselves in. That's really positive. The second figure there is an outlier in a positive way. 26% of our referrals into the hubs are now coming from mental health services. It's normally 1.5% to 3%. We're at 26%. And that is down to the partnership between the HSC and Coolmine. And I can stand over that one in terms of the HSC, liaising with HSC structures, opening the doors, bringing Coolmine in, having a conversation, saying how can we work together. So that is a very positive stat. This is my last slide, and I'm going to conclude on this. We're talking about integrated health services here. What that restructuring and that partnership, and I can't overstate the importance of that partnership, what it has allowed us to do, the HSC and Coolmine and the two task force, is actually map drug and alcohol services onto the broader healthcare system. We're now operating within community healthcare networks, primary care. We're dealing with hospital discharges. We're dealing with delayed transfer of care, extremely complex patients coming out of the hospitals. We've huge referral pathways with liaison psychiatry, great links with community mental health teams. We're doing homeless in reach, and also we've another mobile health unit that the hubs are connected to. So my point really is, once you have a good, solid, robust structure, integrated, good partner in the community like Coolmine, ourselves in the HSC advocating for more, you can get results. And I mean that integrated care, as Tommy alluded to, that is the way to go. And ultimately, to finish,
thank you. This
does work. The HSC working with the community voluntary sector works. When it's done well, when there's a real meaningful partnership, and when you have service users at the heart of it. So, Sinead?
Well done.
Yep, perfect.
What is it about Cork people? I don't know, just rebels. No, Joe, thank you very much. Can I just commend the panel, not just timekeeping, but I think they really gave us an under-the-bonnet understanding of local delivery, integrated delivery, service delivery partnerships, because sometimes these can be concepts. But I think what we're seeing today is that the real active working on the ground between the statutory sector, the voluntary sector, the community sector, Coolmine now integrated into the health system in Cork and Kerry. So I want to commend you. I think you really brought across some really good depth in your presentations. So the panel will stay with us. Again, I'm going to let you go back to your tables with your facilitators to prepare some questions. I will go firstly to the tables that we haven't got to the last time, but for those who did ask questions last time, I will aim to get back around to you again, so do use the time to try come to some questions. And again, I'll take 2 or 3 questions at a time. Over to yourselves. Thank you.